known as MDMA is a stimulant that is classified as a Schedule I drug, which means it has a high potential for abuse and no medical purpose for it. Although it is a stimulant, it acts like a hallucinogenic as well. Ecstasy is often taken as a pill, but could be crushed into a powder and snorted. Effects of ecstasy usually begin within 30 to 60 minutes of ingesting it, and typically last for 3 to 6 hours after consumption. The effects of the drug depend on a person's weight, health, and how often they take drugs. MDMA was created in 1914 by Merck. It was thought it could be used as an appetite suppressant. In the 1970s, it was given to psychotherapy patients because doctors thought it would help their moods and other aspects of life. But in the 1980s, it was banned in the U.S. due to studies that showed it caused brain damage. Unfortunately, in the late 1990s and early 2000s, it became popular among teenagers and young adults. Recently, in the past 15 years, teenagers and young adults have begun to take ecstasy at parties or clubs to increase their energy to dance and party longer. But taking ecstasy combined with being in hot, crowded spaces typically leads to dehydration. Dehydration leads to an increase in body temperature, which can lead to muscle breakdown, kidney, liver, or cardiovascular failure, which could ultimately lead to death. A person may think that if they drink a lot of water, they will not get dehydrated. But drinking too much water while on ecstasy is a bad combination. It could cause brain swelling, and a person could go into a coma and possibly die. Ecstasy affects 3 neurotransmitters in the brain, including serotonin, dopamine, and norepinephrine. Taking ecstasy releases large amounts of serotonin from the brain. It takes a while to rebuild the serotonin levels back into the brain, which causes the effects. There are many short-term effects of taking ecstasy. The most prominent effect is that it produces an intense, pleasurable feeling. It enhances a person's self-confidence and energy. It also causes a feeling of closeness to other people. People on ecstasy are more sociable and have an easier time getting to know other people because their anxiety levels decrease. A person's heart rate and blood pressure also tend to increase. Some other minor short-term effects include involuntary teeth clenching, fixation on lights and sounds, nausea, blurred vision, and sweating. There are also several after effects of taking ecstasy. Feeling fatigue is one of the most common effects because of the increased energy your body had for several hours. Many people report feelings of anxiety and depression. This is a result of the brain's inability to establish normal levels of serotonin in the brain. Other after effects that occur because of a person's serotonin levels are off are lack of concentration and motivation, impaired attention, irritability, and loss of appetite. A person may also have soreness in their jaw as a result of involuntary teeth clenching while they were on ecstasy. Insomnia is also another effect of taking ecstasy. The major long-term effect of taking the drug is the damage it does to the brain. Ecstasy damages brain cells in the brain that produce serotonin. Serotonin controls mood, appetite, pain, learning, and memory. So when cells that produce serotonin are damaged or destroyed, a person faces problems in one or all of these areas. Many people experience mood swings, loss of appetite, problems in learning new things, and inability to remember many things due to low levels of serotonin in the brain. Ecstasy is a highly addictive drug. The main reason it is very addictive is because most forms of ecstasy people buy nowadays is made with a combination of other drugs. So people tend to go through withdrawal 12 hours after consuming it. Some of the beginning symptoms of withdrawal include cravings, insomnia, difficulty concentrating, and restlessness. Some of the more severe symptoms are anxiety, depression, panic attacks, and delusion. Best way for a person to overcome their addiction is to enter rehab. Following rehab, it is recommended that they receive individual or group counseling to help them stay clean. Although ecstasy is a very addictive and dangerous drug, there are studies testing possible medical uses for it. There was one study conducted to see the effects on giving people with PTSD a form of ecstasy 3 times. So far, they have found that these people have had great improvements in life. Ecstasy is also being tested in patients with terminally ill cancer. It is believed that ecstasy helps reduce pain in the patients and make their final weeks and months more bearable. But there is not much information about this yet due to the bad reputation ecstasy has.